Hi, Lorraine here, and we have someone that's interested in giving their opinion on healthcare reform, and they are for healthcare reform. Hi, Lori, how are you today?
Fine, thank you.
And you are for healthcare reform?
Yes, I am. It's long overdue. If you look at the Medicare system, at Medicaid, at the Veterans Administration, medical coverage is something that the government does well, and it's something that every person should be entitled to, not just those fortunate enough to be able to afford it.
Okay, and now what about these supplemental coverages that are in addition to Medicare and Medicaid? How will we support that if they're no longer around?
Well, they're not proposing eliminating them. They would still be around. Private business can compete with government options. They do it all the time. Federal Express, UPS, they're designed to be an option for people that don't want the government option. The government option is something for people to use if they need it. Pennsylvania, in fact, does have a very limited form of a public option buy-in. It's called MAWD, Medicaid for Workers with Disabilities. And if you are working but disabled and you make up to 150% of the poverty line, you can, on a sliding scale, buy into Medicaid if your employer does not provide coverage. And it's a system that works very well. It's very efficient, and it provides coverage to people who have pre-existing conditions who are not eligible for coverage through the current system.
So instead of proposing a national overhaul of our system, would you think that each state would be better off offering a system like Pennsylvania does?
Well, then you have the problem of when you move, you have to get into another system. What Pennsylvania has is only for people with disabilities. It's not for people, with pre-existing conditions, people that have lost their jobs, things like that. If it's through the federal government, it would be a system that is portable. It's not a patchwork of other states doing this and that and different requirements and regulations that would vary by state.
Okay, and in regards to Mr. Kanjorski and Mr. Casey, do you feel that both sides should have the opportunity to be heard here in Scranton, Pennsylvania in a town hall meeting?
I think that everybody should have the opportunity to be heard. The problem is the people that are believing Sarah Palin, believing Rush Limbaugh, and losing touch with reality, they scream, they yell, they don't allow for public discourse. They're so scared because they actually are fooled by these outright lies that they're unable to participate as they should be able to.
Did you read the 1,200-page bill?
No, I haven't, but I've read enough about it, and I have confidence in the Obama administration that they would only act in our best interests.
So your information comes from?
A lot from newspapers, from online.
Any specific organization?
No, I don't have any specific location.
So you're just a citizen that's concerned and voicing your opinion?
Yes, definitely. For example, I am on Medicare right now, and I'm on Social Security because of a disability. Now, I would like to work full-time, but I'm not able to work full-time because if I worked full-time, I'd lose my Medicare, and I wouldn't be able to get health insurance through an employer because I have pre-existing conditions. So what you're doing by allowing the current system to exist is keeping hundreds of thousands of people who could be working and no longer on Social Security, no longer under the Medicare system, to work and have insurance coverage and be more productive members of society.
Now, in regards to coverage through an employer, where do you get the idea that you would not be covered for pre-existing conditions?
Most insurance companies do deny based on pre-existing conditions. That's one of the problems that has led the Obama administration to campaign on and try to deliver on getting something together that would cover people with pre-existing conditions.
That's for individual coverage, not for company coverage. Employers are obligated to cover every employee, so that doesn't apply to an employed person.
Well, employers are responsible for covering employees, but the insurance company can deny, that is, ration care under the current system only to those who are healthy. They can deny care to people who need care. That's rationing that exists under the current system. The actual proposal for universal health coverage would eliminate a lot of that rationing, which makes it ironic that the right-wing pundits are screaming rationing when there's nothing about rationing in the bill whatsoever.